If your knees crack, grind, or shoot with pain the moment you stand up from a chair, I need you to stop doing squats right now. Seriously, put a pause on them. Traditional squats force those painful, already vulnerable joints to carry your entire body weight in a really deep bend. Think about it. If your cartilage is already wearing a bit thin, forcing a squat is practically like taking a piece of sandpaper and rubbing it directly over an open wound. You might think you're building strength, but what's actually happening is that you are actively breaking down the precious joint tissue you still have left. Look, I know you know this daily struggle intimately. You sit down in your favorite recliner to watch a little TV, or maybe you're riding shotgun in the car for a trip across town, and within 30 minutes, your knees just lock up solid. They feel like cement. When you finally try to stand, you wince. You have to lean heavily on the armrests, and you just have to wait a moment for the joint to warm up before you can even take a single step. Please do not accept this as just some inevitable reality you have to live with. Because here is what happens. When you start altering how you walk just to avoid that daily pain, you're actually putting a massive, unnatural strain on your hips and lower spine. You accelerate a sort of mechanical breakdown in the body, and that path leads straight toward relying on a walker or a wheelchair. There was a really comprehensive clinical study published in the Annals of Internal Medicine that looked exactly at this. They found that the primary predictor of severe knee osteoarthritis and that rapid loss of mobility we all want to avoid isn't simply cartilage wear and tear. The true danger, the real culprit here, is profound weakness in the quadriceps. Those are the big muscles encasing the front of your thigh and your knee. Your poor joints are taking brutal, bone-on-bone impact for one simple reason. Your muscles have basically shut down and forgotten how to act as shock absorbers against gravity. But there is a very real, clinically proven way to fix this, and it doesn't involve any of the things you probably hate. You do not need to do heavy squats, you do not need to buy fancy gym equipment, and you absolutely do not need to get down on the floor and struggle to get back up. Today, I'm going to personally walk you through a 5-minute clinical leg routine that we do entirely while safely seated in a chair. We are going to use advanced, targeted isometric techniques to rebuild that protective muscular fortress around your knees. We'll pump healing nutrients right into the joint, and we'll do it without adding a single ounce of damaging pressure. Before we dive right into the routine, though, I really want to hear from you. Tell me, which knee gives you the most grief on a daily basis? Is it your right knee, the left, or are both of them acting up? Take a second and tell me in the comments below right now. I actually read through your comments because it helps me understand exactly what you are dealing with at home. And if you are truly serious about walking pain-free again, please hit that like button, share this video with a friend who might be hurting, and subscribe to the channel so we can keep working together. All right, let's get to work. We are going to count down from number 5. Working our way to the absolute most powerful joint protecting technique at number 1. Number 5, the seated Soleus pump. First things first, we have to start by driving vital circulation directly into the damaged tissues of your knee. I want you to sit right on the edge of your sturdy chair with your feet resting perfectly flat on the floor. Check your knees. Make sure they are bent at a precise 90-degree angle. Now, press the balls of your feet and your toes firmly down into the floor and lift your heels up toward the ceiling as high as you possibly can. Hold that tight squeeze right down there in your lower calf for 2 seconds and then slowly lower your heels back down. We're going to perform this continuous rhythmic pumping motion for 20 repetitions. Let me tell you why we do this. Clinically speaking, the soleus muscle down in your calf actually acts a lot like your body's peripheral heart. When you pump this muscle aggressively, it stimulates the release of something called nitric oxide inside your blood vessels. What that does is force a massive healing surge of oxygen-rich blood and vital nutrients straight into the knee cartilage. Cartilage doesn't have a great blood supply of its own, so this movement accelerates that cellular repair from the inside out. Number 4. The Tibialis shock absorber. Okay, next, we need to protect your knee from the violent impact of taking a normal step. Sit back a little in your chair and extend your legs just slightly out in front of you, making sure your heels stay touching the floor. Keep those heels locked firmly to the ground, and now pull your entire foot and all your toes up toward your shins with as much force as you can muster. Hold that upward flex for 2 solid seconds until you feel a good, solid burn running up the front of your lower leg, and then relax completely. We'll repeat this 15 times. This specific movement zeroes in on the tibialis anterior muscle. Think of it this way. When you are out taking a walk, this muscle is the very first biological shock absorber that switches on the second your heel strikes the pavement. By waking this muscle up right now, you prevent the jarring impact of your body weight from shooting up your shin bone and crashing directly into your knee cartilage. You're creating an instant natural cushion for every step you take. Number 3, the seated friction drag. Moving right along, we must stabilize the back of the knee to stop the joint from feeling like it's shifting around. Grab a small hand towel and place it under your right foot on a smooth surface like tile or hardwood. Sit tall and extend that right leg straight out. Press your heel heavily down into the floor. Now, instead of lifting your leg up, I want you to drag your heel backward toward the chair, fighting really hard against the friction of the towel on the floor. You are going to feel a really intense contraction in the back of your thigh. Do this 10 times, very, very slowly, and then switch to do the same on the other side. We call this a closed-kinetic chain technique, and it heavily activates those hamstring muscles. You see, a strong hamstring acts almost like a secondary anterior cruciate ligament, or ACL. By building strength in the back of your leg, you are physically stopping your shin bone from sliding dangerously forward. This is the secret to instantly eliminating that loose, unstable, clicking sensation you might feel when you walk across the room. Number 2, the cross-ankle isometric press. Now it is time to strengthen the massive muscles on the front of your thighs, but we are going to do it without grinding your kneecap. Sit up straight, lift your right leg, and cross your right ankle securely over the front of your left shin, right there just below the knee. Now, attempt to kick your right leg straight forward, but at the exact same time, use your left leg to push backward and block that kick with equal force. Neither leg should actually move an inch. Hold this maximum pressing tension for 5 seconds. Relax, repeat this 5 times, and then switch your ankles to do the other side. In the clinic, we call this a self-resisted isometric contraction. It's brilliant because it allows your quadriceps to fire and contract with maximum neurological force to build real strength. But since the joint itself remains completely locked and still, there is absolutely zero compressive force grinding against your kneecap or your meniscus. According to standard physical therapy principles, this is unequivocally the safest method to build heavy, protective muscle around a joint that is already inflamed or arthritic. Number 1, the 1 mm hover. We have finally reached the most effective movement of the entire routine, what I like to call the clinical anti-squat. Sit right near the edge of your chair again with your feet planted firmly beneath your knees. Lean your torso just slightly forward, keeping your spine perfectly straight. Press your feet heavily into the floor, tighten up your thighs and your glutes, and attempt to lift your hips exactly 1 single millimeter off the chair. Do not actually stand up. I just want you hovering, taking the dead weight of your body off the seat cushion. Hold this incredibly tense position for 3 seconds and then sit back down safely. We are going to repeat this 10 times. I cannot stress enough how powerful this is. This is the ultimate neuromuscular rehabilitation exercise. It basically trains your central nervous system to fire your quadriceps, hamstrings, and gluteal muscles in perfect, synchronized harmony to prepare you for the act of standing. You are neurologically rebuilding the exact motor control your body requires to safely lift your body weight, and you're doing it while completely eliminating those dangerous, shearing forces inside the joint that you'd get from a traditional deep squat. By practicing these 5 precise clinical movements every single day, right from the safety of your living room chair, you are going to build an impenetrable fortress of strong muscle around those vulnerable joints. You will increase that much-needed circulation, restore your knees' mechanical stability, and truly regain your confidence to move around the house or out in the yard. And you will do it all without ever having to suffer through a single painful squat again. Please, make this joint-safe routine a non-negotiable part of your daily life. Your knees will thank you.